Hello, good day and welcome everyone. I'm super excited to have you here and thank you for joining our webinar tonight. So my name is Stephanie and I'll be your host today. I'm a clinic assistant here at Sunway TCM Center and our event for tonight is titled Impact of TCM on Post-COVID-19 Recovery. So before we begin, let me remind you one thing. We will be recording today's session, and if you like, you can review them again on our YouTube channel later on. And if you have any questions throughout the session, you may comment them in the Q&A box, and we will collect and answer them at the end. So without further ado, let's begin. So tonight we have two presenters. Our first presenter is Ms. Man Weng. She graduated bachelor degree and Master of Chinese Medicine from Beijing University of Chinese Medicine. She is a TCM Senior Physician here in Sunway TCM Center, and she specialized in women's health. She is also a guest speaker for several TV stations and radio stations. Our second presenter is Ms. Kee Yie. She graduated with a degree of bachelor degree of Chinese medicine from Utah, Malaysia. She is a TCM physician in Sunway TCM Center as well, with a special interest in stroke rehabilitation as well as post-COVID recovery. So Ms. Hu is actively involved in various medical conferences where she has published several articles as well as conducted presentations. She is also one of the consultants of Phoenix Signature Kitchen. So without further ado, let's invite our first speaker, Ms. Man. Over to you, Ms. Man.
Hi, thank you, Stephanie. Hi, everybody. It's a pleasure to be with you. I'm Miss Man. So in today's webinar, Miss Hu and I are going to share about what is post-COVID-19, TCM perspective, and how traditional Chinese medicine are used in treating post-COVID-19 symptoms. We will share some self-care tips as well, which helps in strengthening the immune system. Okay, so the next slide will be, nowadays we've heard a lot of long-term effects of COVID-19 through internet or social media with terms like long COVID, post-COVID syndrome, COVID-19, long haul symptoms, etc. So how is post-COVID-19 different from COVID-19. So according to post-COVID-19 management protocol published by our Ministry of Health, there are 3 phases following infection with COVID-19. So once a person infected by the COVID virus, he or she may enter the acute COVID-19 phase, which symptoms like fever, sore throat, coughing, or pneumonia, etc., could appear for up to 4 weeks. For non-severe COVID patients, most of them will recover within 2 to 3 weeks, while patients who still have mild symptoms lasting between 4 to 12 weeks since infection are considered as ongoing symptomatic COVID-19, and post-COVID-19 syndrome are those who has symptoms continue for more than 12 weeks since the infection, also known as long COVID. So there are the list of long COVID symptoms in the next slide, which is commonly seen among the COVID-19 survivors. So the 5 most commonly reported symptoms were fatigue, shortness of breath, insomnia, cough, and anxiety. So of course, there's a lot of patients some post-COVID-19 patients also approach us mostly complaining about some depression or sleeping disorders and other coughing issue as well. So some of you may wonder, does this mean that every COVID-19 patients will have long COVID even after they are recovered? So actually it varies. Most of the people can fully recover and return to normal health, but some can have prolonged symptoms and are not infectious. So the next slide mostly is mentioning about long COVID symptoms are commonly seen among among category 4 and 5 survivors. So it really doesn't mean that if you are like having it doesn't mean that if you got infected by COVID-19, you definitely will have long COVID. It depends on how severe the condition is, but of course there are some minority patients who, even though they are just have in category 1 or 2 without pneumonia condition, they may also have symptoms like fatigueness as well after recovered. But of course, they are not infectious during the post-COVID recovery journey. So the next slide, I would like to invite Ms. Hu to share us about the TCM perspective on COVID-19.
Okay, thank you, Ms. Man. All right. So hi everyone, I'm Ms. Hu, and let me share some TCM perspective view on the post-COVID-19. So does any one of you been visit to a TCM center? And have you done any treatments such as acupuncture, 𝐸𝐸𝐻, or just got some herbal prescription from the TCM physicians? And in TCM, we look into syndrome differentiation before proceed any treatment plan. Okay, so as most of the COVID patients have common initial symptoms including fever, dry cough, chest discomfort, nausea, diarrhea, and some of them might have loss of taste, loss of smell. And considering Malaysia has a humid and hot climate with a higher degree of dampness, therefore, the initial syndrome was mainly categorized by dampness, which is the inventions of pathogens due to low immunity. In TCM, we call deficiency of healthy qi. So along with the increase of dampness and the toxin combining with heat or cold pathogens entering into the interior body, so the herbal meds is usually individualized to each patient. There is no one-size-fits-all solutions in TCM. So after appropriate treatment and the dispelling of the epidemic toxins, then patient move on to the recovery stage as the qi and yin of the patient's body are deteriorate, and TCM herbal meds with the functions of tonifying qi and nourishing yin for the lung and the spleens will be prescribed for the symptoms such as fatigue, shortness of breath, insomnia, loss of taste or smell, etc. Okay, so move to the next slide. Okay, so over the past several months in our center, we do have COVID patients from category 1 to category 4. We've given the treatments of herbal medicine. So we do teleconsultations, which is something like video call. We will get them to take a picture of their tongue to diagnose their conditions like the color, the clotting, and ask some questions like how often they cough, how is the color of the phlegm, and how is their daily activity. And finally, we will prescribe the herbal meds personalized to each individual. Thus, the tongue diagnosis is very important tool for our TCM to assess the health of patients. So many people have a combinations of pattern occurring at the same time, so making the diagnosis more complicated. So usually first, we will look at the tongue body, the color of the tongue body, and then the tongue body size, and also lastly, we will see the tongue coating. Okay, so for example, this is a tongue picture from one of my previous COVID patients. And here we can call this patient as patient A. Okay, so patient A, as you can see, she has some symptoms of taste alter and diarrhea, poor appetite, and fatigue is a very common symptom of COVID. And as we can see from the picture, she has an enlarged or fat tongue, which indicates phlegm and is a sign of congestion of body fluids. And then you can see there is a teeth marks and on the side of the tongue, which indicates spleen qi deficiency. And lastly, you can see the coating. So the coating you can see is a white color and thick tongue coating, which indicates dampness. Okay. And then, so from the tongue picture, then we can do diagnosis. We can know that from the teeth marks and also the symptoms she told us. Like, for example, the teeth marks is present as a weak digestion. So she got the test ulcer, she got diarrhea, fatigue, those symptoms. And also for the thick white coating is also is a pathological accumulation of fluids associated with the digestive impairment. Okay, so for here I need to pass to Ms. Man to continue for the TCM management.
Okay, so while for the TCM wise, in treating those post-COVID patients, there are some studies showing that actually TCM has played a crucial role in recovery phase after the infection. So most of the post-COVID-19 patients having concerns about their immune system and eager to gain back to their normal health sooner. So we will use TCM treatments such as Chinese herbal therapy, acupuncture, moxibustion, and dietary therapy, auricular therapy to form a treatment plan based on their condition. So these treatments can help in reducing phlegm, increasing their stamina, strengthening their lung function, as well as improving their quality of life. So the next slide, in this study actually is showing Chinese herbal therapy can help in balancing the immune response, regulating the production of new blood cells, and also increasing nutrient intakes in order to speed up the recovery process. So it is effective and safe to be used during the post-COVID-19 recovery. So the next slide will be Ms. Hu in sharing the management and self-care tips.
Okay, so mostly I will share is for the self-care, what you can do at your home. Okay, so as we know, fatigue is a very common symptoms after the viral infection, especially for post-COVID patients. And the United Kingdom National Health Service has created a easy that patients can use help to cope the fatigue. Okay, so it called 4P method. So you can see to the next slide. Okay, so it's planning, pacing, prioritizing, and positioning. Okay, so planning, always plans around the times of the day you have the most energy. Okay, so the second will be pacing, pace yourself while doing the task. Be steady, okay, and prioritizing means that to deprioritize the task that is less important to do in the daily life. And positioning positions the item and activity to be easy to reach and use. Okay, so next, in TCM, we also recommend our patient to do belly breathing. Okay, belly breathing is the key of the wellness and improve the qi and blood flow in TCM. So, and it can improve our lung capacity, promoting the relaxations by reducing the harmful effects of the stress hormone cortisol on your body, and also improve the body abilities to tolerate the intense exercise. And next, besides 八段锦is also a kind of exercise that can help to improve our blood circulations and to reduce our tightness, and also relax our muscle and balance metabolism to minimize the sleep problems. And we are currently preparing the tutorials of 八段锦 and will be posted to our YouTube channel soon. So do subscribe our YouTube channel and learn the health tips from us. Okay, so this pandemic actually is inducing a considerable degree of fear, worry, and concern. So among patients, caregiver, and also our healthcare colleagues. So it's okay. So, okay, so those mental health issues are normal response. Give yourself periods of time to take care of your emotional well-being. So take a break from constantly watching the news, okay? And relieve your hobbies, spend times on your hobbies or any physical activities, to maintain healthy diet, and do not hide your illness. If you found that, you can give yourself a period of time, but if you found that if you can't cope, ask for help. Okay, so it can feel like our daily life is back to normal, but the coronavirus actually is still here. So in addition to adhere the SOP, what else can we do to strengthen our immunity? Okay, so it is very simple. No matter you are COVID or non-COVID, we can boost our immune system and help our body fight against the infection through three main things. Okay, so the first one is get enough quality sleep. So try to practice a regular sleeping and waking times, using alarms to remind you, especially for those who are working from home, and sleep at least 7 hours every night regularly to promote the optimal health among adults aged between 18 to 60 years old. To avoid consume caffeine, sugary foods or drinks at least 4 hours before bedtime. And to ensure that the environment is free from the things that might disturb you, such as light or noise. Okay, so the second will be physically active. Physical activity does not need to be strenuous to be effective. 30 minutes a day of moderate to vigorous intensity activity on 5 or more days a week is considered sufficient for health benefits. For example, brisk walking. Okay, so the lastly will be eating sufficiently and healthily. Our body needs many different types of foods in varying amounts to maintain health. So you may follow the principle of suku separuh recommend from KKM. For those who have poor appetite, you do not have to stick the 3 meals a day. Just eat small meals and more often. So, but how if you feel difficult for doing any one of these, then it's time for you to reach us. If you have any symptoms and any health concern, okay, so can move on to the next slide. Thanks, Stephanie. Okay, so if you have any symptom and any health concern, please drop a message to our WhatsApp and book an appointment with our TCM physicians to know more about your own body health conditions. And it is important that to go for a certified and qualified TCM practitioner. Okay, and lastly, this is a leaflet from WHO, which provides basic exercise and advice for adults who have been severely unwell or admitted to the hospital with COVID-19 or even for post-COVID patients. So you can scan the QR code on the right side or screenshot this page to download and share to your loved ones. In this leaflet, you can learn how to ease the breathlessness, which is one of the common symptoms of COVID. Very straightforward and easy to use guide. So that's all for our sharing tonight. So thank you for your time.
Okay, thank you, Ms. Man and Ms. Hu for such an informative session. So before moving on to our Q&A session, we would also like to introduce to you our post-COVID recovery program, which is available here at our Sunway TCM Center. So it is catered to help post-COVID patients in their recovery process, which we can know from the presentation just now that it can be quite an arduous process where patients would experience residual symptoms, which can be really uncomfortable. So we have here 2 different packages to suit individual patients' need. And so if you have any question or if you have any interest and you feel you could help your friends or family, feel free to reach out to us for more information. So we will now move on to our